I'm sorry that this video is coming a little late, but I hope it will help you, all the exam going students, how to do an obstetric examination. So like in any field of medicine, when you're doing an examination, never start by touching the patient. The first thing is that you always start from inspection. So you go for inspection, then palpation. Here percussion is not done in obstetric examination. There is special obstetric examination or special grips which are done, and then finally auscultation of the fetal heart sounds. So whenever we start on inspection, the first thing we need to mention about linea nigra, which is a line which is darkened line seen on the tummy of the mother. The second thing is trigravidarum, which are usually present. They are the stretch marks which are seen in the epidermis. So that is the second thing. Always make a mention about any scar which is present. So maybe a patient has undergone some appendicectomy or a previous cesarean section or a cholecystectomy or some laparoscopic scars. So in case there is any scar which is seen on inspection, please make a mention about it. Also check for any hernial sites or there is any abnormality of the umbilicus or any fungal infection, any other darkening, any burn marks. So anything abnormal seen on inspection must be clearly noted and explained to the examiner. The second thing, after you have finished the inspection, remember the most important is the patient should be very well covered. So when you start examining, you will always be standing on the right side of the patient. The patient will be properly covered, the legs will be flexed, and before starting the examination, explain the procedure to the patient and see to it that she has passed urine, because if the bladder is full, the fundal height will vary. Now coming to the fundal height, because it is important to know what is the gestation of the pregnancy. So fundal height at 12 weeks. At the pubic symphysis, it is considered to be 12 weeks. So from pubic symphysis till umbilicus, we divide into 3 equal parts: 12 to 16 weeks, 16 to 20 weeks, and 20 to 24 weeks at the level of umbilicus. Once again, at pubic symphysis, it is 12 weeks, then 16 weeks, 20 weeks, and at the umbilicus, it is 24 weeks. After this, till xiphisternum, again this whole portion is equally divided into 3 parts. So from 24 weeks it is 28 weeks, from 28 weeks it is 32 weeks, from 32 weeks it is at 36 weeks. So at the level of xiphisternum it is 36 weeks. Now many times 32 weeks could also be 40 weeks in case the head has gone down or it has got engaged or it has dipped into the pelvis. So if the head has gone down, the fundal height will correspond probably to 32-34 weeks, but there the flanks will become full and the engagement has already occurred. So this is something more important for the postgraduate students rather than the undergraduate students. So whenever you are doing an examination of fundal height, always use your left ulnar border. You don't do it from the right side. You don't do fundal height like this. It has to be always done from the left ulnar border. You go to the xiphisternum and start slowly palpating downwards. The first place where you feel the resistance is where your fundal height. You just mark it, and then as we have explained, now here it is kind of corresponding to around 32 weeks in this. So this is how you check for the fundal height. After the fundal height, we come to the actual obstetric grips, which is called as Leopold's maneuver or Leopold's grip. Here the first grip is fundal grip. Here you are facing the face of the patient. Use your both hands and gently try to palpate the fundus to find out what is the part which is occupying the fundus of the uterus. In case considering that it is a cephalic presentation, that means the head of the baby is down and buttocks are above, it will be normally a broad, globular, non-ballotable kind of a structure which is occupying the fundal grip. Once you have finished the fundal grip, you will start with the lateral grip. The second grip is lateral grip. Here you stabilize you stabilize one palm and start palpating from the other hand, slowly from below upwards. So you start gently palpating and trying to find out what kind of structures you feel on that side. Once you have done that, you stabilize this hand and you start palpating from here, below upwards, slowly. The place where you can feel a continuous board-like structure which is harder is the back of the baby. and the other side where you can feel small knob-like structures is most probably the limb. So you say that a continuous board-like structure is felt. Here I can feel it on the left side of the patient, and you can feel small nodular structures, and many times you can reconfirm asking the patient that does she feel more movements on the other side where there are small limbs, the movements are also perceived little more. After this there is third and fourth grip. So rather than getting confused between third grip and fourth grip, use poly grip and deep pelvic grip. Now poly grip is again done by using right ulnar border. You place it on the pubic symphysis and gently try to catch hold of the presenting part and give it a gentle ballotment. This is how it is done. So you place it on the pubic symphysis, try to hold whatever is here and give it. Now this grip tells us what is the precise presenting part and has it got engaged. In case it is got, if it is very high, you can actually ballot it like this. If it is got engaged, the proper ballotment will not be possible, and you can make out, it comes with experience, but you can find out if the head has got engaged or no. Also you will come to know if what is the presenting part, is it breech or cephalic. In case it is empty, then you have to, you want to reconfirm if it's a transverse line. So empty polygrip is also very important. Now coming to the last grip. Here this is the only grip where we are actually facing the leg of the mother, and using both the ulnar borders, we place it parallel to the inguinal ligament and we try to reach beyond the presenting part. This is a very, very important grip, especially in women where they are going to go into labor or you are planning a delivery. It will tell you what is the precise presenting part, is it engaged or no, and it will also tell us what is the attitude of the baby in case it's a cephalic presentation. So consider that this is the back. So the occiput will be on the same side. If this is my back, the occiput is also on the same side. And front, and this is where the sensiput. So once you have found out where is the back, you can find out where is the occiput. If the occiput is lower and the sensiput is higher, that means the head has been completely flexed. That means the baby is in complete attitude of flexion, which is a good thing. So now coming to the final part of our examination is the fetal heart sound. Once you have found out where is the back, just draw an imaginary line between the spine, anterior superior leg spine, and the umbilicus, and you will most probably find the fetal heart rate on this line somewhere. So if the thing is, normally the fetal heart rate is best heard from the anterior shoulder, back of the anterior shoulder of the fetus. So that is where if the examiner asks you, you should know that the fetal heart sounds are heard through the back of the anterior shoulder of the baby. I hope this little video will help you performing well in your examinations. In case there is any doubt, do leave a comment in the comment box. Thank you so much. Some very important tips when you are coming for your examination is always wear a clean and neat apron. Always have a stethoscope and carry a measuring tape. Sometimes a symphysiofundal height will be asked to you, so do read about it. It's a good habit to carry. One more thing which you can always add to your examination is you can sometimes see the fetal movement. So if you have seen the fetal movement, do mention that on inspection you could actually see the fetal movement. So that it adds a brownie point, and you can always utilize that, and you can reconfirm with the mother. Did the baby move immediately? So it is like, it is 100% surety that the baby is doing well. So I hope you will enjoy this video, watching this video, and do share with your friends so that everybody can learn basic obstetric examination.